Hello everyone, welcome back to my channel. I am Baisali Bharadwaj Dash, a student of 2nd MSc Food Science and Nutrition of National Institute for Home Science and Higher Education for Women. In this video, I'll talk about the nutritional lifestyle changes during pregnancy. In the previous video, we saw till obesity and will continue in this video from gestational diabetes mellitus, why eating fish during pregnancy is important, physical activity for a healthy pregnancy, complications in pregnancy, nausea and vomiting in pregnancy, and in the last section, we'll see some myths that are surrounded during pregnancy. So, gestational diabetes mellitus or GDM is a condition in which a hormone made by the placenta prevents the body from using insulin effectively. Glucose builds up in the blood instead of being absorbed by the cells. These gestational diabetic symptoms disappear following delivery. Although any woman can develop GDM during pregnancy, some of the factors that may increase the risk include obesity or overweight, family history of diabetes, having given birth previously to an infant weighing more than 9 pounds, age, that is, women who are older than 25 are at a greater risk of developing gestational diabetes than younger women, and pre-diabetics, also known as impaired glucose tolerance. A mother has a higher risk of hypertension, preeclampsia, cesarean delivery, and labor complications. Infants is at increased risk of microsomia, large for gestational age, fetal organomegaly, shoulder dystocia, hypoglycemia, and perinatal morbidity and mortality. Next, why is eating fish important during pregnancy? There is a myth that pregnant women should not eat fish. It is completely false. Fish is a very good source of long-chain polyunsaturated omega-3 fatty acids, especially EPA and DHA, and these are essential for our body and relatively large amounts are needed for fetal growth. Oily fish is a major dietary source of EPA and DHA. Small amounts of EPA and DHA are found in other fats like vegetables, oils. Therefore, dietary supply of EPA and DHA from fish and other sources becomes particularly important during pregnancy. Fish also contains other essential nutrients, particularly vitamin D and iodine, and it is a good source of chlorine, selenium, iron, zinc, and copper. However, 7 types of fish should be completely avoided during pregnancy because they contain high levels of mercury like Vigiatonia, tilefish, char, swordfish, marlin, orange roughy, and king mackerel. Physical activity for a healthy pregnancy. Pregnant women should establish a physical activity routine. They should accumulate 150 minutes of moderate physical activity each week. Physical activity should be encouraged every day, but at least over a minimum of 3 days per week should be practiced. Pregnant women should do pelvic-related exercises daily. A variety of physical exercises can be done like yoga, aerobics, stretching, etc. Physical activity program should be individualized for each woman based on her situation, experience, and current health and nutritional status. Benefits of physical activity during pregnancy are it reduces pregnancy-related back pain, decreases constipation, improves energy levels, helps maintain a healthy weight, maintains heart and lung capacity, lowers diabetes, preeclampsia, and cesarean section delivery risks. There are some guidelines for exercising during pregnancy, which are number 1, adhering to restrictions from the doctor or midwife. Number 2, starting slow and always warming up first. Number 3, protecting the belly by avoiding any activities that compress the abdomen. Number 4, after the first trimester, avoiding doing any exercises while laying down on the back. Number 5, hydrating themselves well to prevent overheating and dehydration. Number 6, consuming enough calories to support both pregnancy and exercise. Number 7, avoiding contact sports and or activities that require quick changes in direction. Next, we will see some complications associated with pregnancy. First is gestational diabetes. As we saw before, it is a type of diabetes that suddenly appears during pregnancy and disappears after birth. Next is preeclampsia. It is a condition associated with high blood pressure and high protein levels in the urine, which causes swelling in ankles, feet, and hands, pain in the ribs, vision issues, and headache. Next is low amniotic fluid. Insufficient levels of amniotic fluid can complicate pregnancy and result in premature delivery. Next are infections during pregnancy. Some certain infections occur during pregnancy like urinary tract infection, toxoplasmosis, and they can potentially cross the placenta and cause serious complications. Rh incompatibility. It occurs when an Rh negative woman is exposed to Rh positive blood during pregnancy and delivery. Though it is not harmful to the mother, this pregnancy complication can have serious effects on the developing baby. Next is ectopic pregnancy. It occurs when a fertilized egg attaches itself outside the uterus, complicating the natural propagation of the pregnancy. Since the fetus can only develop in the uterus, ectopic pregnancies always end with death. Next is premature birth. It is a birth that happens more than 3 weeks before the estimated due date or before the 37th week of gestation. Next is miscarriage. Miscarriage is a spontaneous fetal loss that occurs in the first 20 weeks of gestation, and it is one of the most common pregnancy complications. Next is stillbirth. It is a fetal loss that occurs after 20th week of gestation, either in uterus or during labor and delivery. Next is anemia. Severe iron deficiency anemia during pregnancy increases the risk of premature birth. Next is constipation. The pressure of enlarging uterus on the lower portion of the intestine, in addition to the hormonal muscle relaxant effect of placental hormones in the gastrointestinal tract, may result in constipation. Next is oedema. The swelling of the lower extremities may be caused by the pressure of the enlarging uterus on the veins, returning fluid from the legs. Next, we'll see about nausea and vomiting in pregnancy. Nausea in pregnancy may be due to nervous disturbances, placental protein intoxication, or due to derangement in carbohydrate metabolism. Morning sickness in early pregnancy can be improved by small and frequent meals, taking easily digested energy foods such as carbohydrates and more readily tolerated. Liquids may best be taken between meals instead with food. If the condition develops to hypermissive gravidian, which is a severe, prolonged, persistent vomiting, peripheral parental nutrition and careful oral feeding is essential. Skim milk is better tolerated than whole milk. Fruits and vegetables can be included. Fatty rich foods, fried foods, excessive seasoning, coffee in large amounts, and strongly flavored vegetables may be restricted or eliminated if nausea persists. Next, here we'll see some myths that are associated with pregnancy. The first is, if I am pregnant, I have to eat two. I have to eat for two. This is a myth, and the fact behind is that from the third month of pregnancy, one would need about 200 to 300 extra calories per day, and instead of eating for two, eating healthy food is more important. One definitely needs to increase the amount of certain essential nutrients during pregnancy, such as protein, iron, calcium, and folic acid. Next myth is, if a pregnant woman is craving a certain food item, it means that her body needs to have that food. It is a myth, and the fact behind is that women can crave any food type, and it should not be an only indicator to assess her nutritional needs at that time. Next myth is, if I am healthy, then I won't have any discomfort during pregnancy. The fact is, even healthy women may experience nausea, heartburn, and constipation during pregnancy. But women who opt for healthy meals, drink plenty of water, exercise regularly, and avoid addition of sugar and fat can substantially reduce these troublesome symptoms. Next myth is, I cannot have fish during pregnancy. We have already talked about this before. Fact is, including 2 servings of fish per week can benefit both mother and the baby. And cold water fish especially contains a good amount of omega-3 fatty acids that can help in the baby's brain development and vision. But of course, we have to avoid certain fishes which have high level of mercury, such as swordfish, shark, tilefish, and king mackerel. Moreover, avoiding raw fish is also important. Next myth is, every woman has to put on about 30 pounds, that is about 13.5 kgs during her pregnancy. The fact is, the amount of weight a pregnant woman needs to gain depends on her weight before she got pregnant or her pre-pregnancy BMI. Next myth is it is okay to occasionally drink during pregnancy without harming the baby. The fact is there is no real safe level of alcohol consumption. Even less than one drink per week can result in serious birth defects. Consuming alcohol can also impact the learning ability and growth of the baby and also increase the risk of sudden infant death syndrome. Next myth is if I will consume salt, it will lead to swelling. Fact is, salt is an essential nutrient, and during pregnancy, some swelling is very normal. During pregnancy, sodium requirement is slightly higher, but most women get enough sodium from their typical diet, so there is no need to use additional salt. Next myth is I need to eat meat during pregnancy. The additional iron and protein need during pregnancy is difficult to get without meat. But as long as foods like soy nuts, peanut butter, fortified cereals, spinach, and dried apricots are included in the diet, one should be able to meet their protein and iron needs without eating meat. Next myth is a low fat diet will keep the extra weight at bay. The fact is, fat is an essential important nutrient to help the body utilize vitamins, but its quantity matters. Opting for a low fat diet can be harmful during pregnancy as food sources that are considered fatty are often good sources of protein, which is very important for the mother. Fat consumption should be about 30% of the daily calories. The last myth is I have to avoid all the medications during pregnancy. Fact is, there are many medications that can be safely used during pregnancy, but it is also true that certain medication and nutritional supplements should be avoided at this time. So, making sure to consult your doctor before taking any medication is important. These are the references that I have used to make this PPT and video. Thank you for your patient listening. If you like the video, do like, share, and subscribe to my channel. Thank you.